I have to start before I start. I have to tell you that I asked Dean when he took off his hat, I said, "Is that allowed?" And he said, "It's hot." And he said, "In public health, we just do what we have to do." So I love you guys for that. So that's great. Thank you so much, Dean Finnegan, for the profound honor of addressing these talented graduates, their sage professors, and their family and friends, all who are here, rightfully proud and maybe in some cases relieved that this day has come. The last time I was on stage here at Northrop Auditorium, I was 10 years old, and I was playing the piano in a 10-piano duet competition. I had the bass clef. I hated the bass clef. I was insufficiently prepared and didn't play the notes all that well. So I'm hoping that I have fewer clinkers today because I want to honor you in the most profound way. To do so is really immensely important to me, as you're so worthy of that honor. And I couldn't be prouder than to be a triple gopher by background and to be partnering with you, all of you, now and into the future to improve the lives of those we collectively serve. We share something really precious together. Together we share a noble mission. As Teddy Roosevelt said, "Far and away the best prize life has to offer is the chance to work hard at work worth doing." My daughter Olivia paraphrased this a bit when she was 8 years old. She said, "My mom used to be a doctor," to which I took a little offense. But anyway, because I still am. But my mother used to be a doctor. Now she just does something about improving people's lives. So I thought that wasn't a bad gig, and that we all get to do that. Together we have a tremendous opportunity to positively impact people's lives in unprecedented ways through the connection between healthcare and public health. The lives of so many and the health of our broader communities depend on the convergence of our two worlds. We can't let this brilliant opportunity pass. We simply can't. Through remarks on this very big day for us all, I want to give you an understanding from my perspective on three things. One is why individual and community stories can and need to be positively rewritten. The other is how we can do this together at this unique time. We're really at a unique moment in history. How do we seize that? And lastly, what transformative demands of your talents and your character to change healthcare for the better are required for this transformation? So let me just start there. I want to start with some stories, and one in particular. Stories that keep us awake, stories that don't need to take the tough and tragic turns they've taken. One such story is really burned into my memory, and that's of a woman named Marletta. Marletta was a kind and wonderful and loving woman who had a really tough lot in life. A single mother of a 3-year-old son, Marletta had not graduated from high school. She lived on less than a livable wage. She was challenged physically by severe obesity and diabetes. I met her on a night that we would struggle to save her life. She came into the emergency room. She was 27 weeks pregnant with abdominal pain and a bulge in her abdomen that was considered to be a weakening in her abdominal wall, a hernia. She had only had one care visit during her prenatal course, and when she was in the operating room, I'll do it too, when she was in the operating room, what was thought to be a hernia was something rare and quite frightening. Marletta had a condition that was a surgical and obstetrical nightmare. It was a placenta precreta. A placenta precreta is when the placenta, which nourishes the baby, actually grows not just on the uterus, but through the uterus and into other organ systems. In Marletta's case, it went all the way through her bladder. This dire emergency often results in severe and uncontrollable bleeding and irreparable damage to the affected organs. We delivered her premature infant girl, then worked through the night to repair the severe damage while feverishly trying to keep up with her blood loss. After operating into the wee small hours of the morning and 23 units of blood later and 5 days in the intensive care later, Marletta took a turn for the better. Her turn for the better was complicated by a severe infection of her wound being brought on by her severe obesity and her diabetes, and her wound had to heal, but what we call secondary intent, just filling in on its own over weeks of time, and she was in the hospital for another 3 weeks. Her infant survived as well, and they were both discharged to home. Unfortunately, after nearly losing her life, Marletta's life got harder still. While she earnestly held down a cleaning job and carefully and kindly and diligently took care of her 2 children, her boyfriend was cocaine addicted and abusive. 5 years after being a near medical miracle, they fought over his drug use, and he strangled Marletta to death. A sad story. How might life have been different for Marletta if we had partnered with all our assets to serve in better ways? What if she had been supported to finish her education? What if she had had access to healthcare screening that led her to a stress and weight management program and diabetic care, or had been offered these at her prenatal visit? What if a community health worker had been embedded in her neighborhood? What if she had been enrolled in a women and infant and child program after she recovered from her surgery and had that kind of support? What if someone to whom she could turn was there when her boyfriend turned abusive? What if, in the words of the Robert Wood Johnson Foundation, Marletta was surrounded by a culture of health? What if she had choices? Would her 2 children still have a mother? Of course, there are other stories that keep us awake as well. I know of John, a victim of inequitable care who died prematurely of a heart ailment. His mother, in describing his death, said she felt like he was erased from support services and from the healthcare system itself. Or how about Andy, a 17-year-old who had a mental health crisis? Given no access to local care, no room in the inn for this mental health crisis, he was shipped 120 miles away to a hospital bed, had no follow-up care, had medication complications, quit taking his medications, and committed suicide 2 weeks later. These stories are heartbreaking, especially when we know that we are all interconnected and responsible for each other and each other's well-being. While we can't rewrite those history of Marletta, of John, and Andy, we can do a lot. Together we can support the many we don't yet know and enable them to have better choices, lead better lives, and extend their capacity to love and support those around them. To do so, we have to converge medical care and public health. We are finally understanding in my world, that of healthcare, that we're only a little part of somebody's health. If we don't have one foot in healthcare and a larger foot in the community working together to create more positive conditions for health, people will suffer. Public health has the data and the connections to reveal the problems in the community, and the clinicians have the direct patient and community member connections to bring these stories to light and change perspectives, behaviors, and policy. Together, we need to collaborate even more with each other, with other sectors, and with communities themselves to catalyze a big turn towards better health for all. There are other positive examples of change all over our state that we can build on. Dean Finnegan mentioned one. At Allina Health, we are privileged to be working on a creative partnership with our neighbors and communities immediately surrounding our headquarters in the old Sears building, the Phillips Powderhorn Negative. Now our headquarters are the vibrant Midtown Global Market and Commons, and our largest hospital, Abbott Northwestern, is in the community as well. For the past 7 years, we have worked on something we call the Backyard Initiative with the School of Public Health. It's evolved into a promising example of community-led change. In fact, those of us at Allina had a big lesson to learn from the community at the start. You see, we thought of it as working to improve the health of the people in Allina's backyard. And pretty soon, the community's leaders straightened us out. They came to us and essentially said, excuse me, Allina, but this is our backyard, not yours. Luckily, we listened. Citizens, neighbors have defined for themselves what health is and zeroed in on social cohesion as a core health strategy. They've formed citizen health action teams to drive the changes and choosing their design. One of these citizen action teams is called the Partnership of Diabetics that gathers and offers strong peer support for those with this chronic condition. I can't help but wonder, if Marletta had had that community team on her side, whether her story might have taken more positive turns. It won't be easy to get all this done right. So ultimately, there are no preventable tragic stories left to tell. In fact, it will be an incredible challenge to change the ways of thinking and doing things for the better. There will be whitewater along the way. It will be a character test for us as individuals and as a community. What will it take to relieve this unnecessary suffering? Is it a Sisyphean task to accomplish this? The task of building a healthier state, nation, and world is indeed tremendous and will test the character of each of you in the room. I offer 3 pieces of advice to help get us there. First of all, always clarify the intent of the change. Why is it important? How will lives be impacted for the better? Make it mean something. A diabetic program doesn't mean much if it looks like, oh, we did better glucose control for the population. It looks like something if we gave more optimal diabetes care and there's somebody walking around the lake with his grandson who wouldn't have had that walk before. Make it mean something. Secondly, drive, don't slide. Always bring your best and expect the best of those who work with you. Be intolerant of anything that gets in the way of improving a life or lives. Be simply intolerant. Always bring your best. Drive, don't slide. Thirdly, and importantly, lead with love. Make love your legacy. In the end, it is your passionate purpose that will carry you through the whitewater of change and resistance. Lead us to our collective ability to improve lives in unprecedented ways and provide congruence between what we value at work, at home, and in our community. Lead with love. Ultimately, our job together is to relieve suffering and extend hope and possibility. We have a moral imperative to do so, and by relieving undue suffering of those whose faces we may not know, but whose lives we have collectively committed to improving, is work well worth doing. Dr. Don Berwick, a wonderful mentor to so many, and to me personally, said, I think healthcare is more about love than anything else, for it's if not one person trying to relieve the suffering of another, and that's not love, I don't know what is. Our job is to connect healthcare and public health and to extend that love and benefit to many. It's a charge and an opportunity for this moment in history, a moment where health systems like mine are finally realizing what it's meant to be more about responding to illness, we're meant also to be about health. Let's meet at the nexus and profoundly change the health and life for untold members and numbers of Marlettas. We need each other, and those we collectively fortunate enough to serve need you. In this moment, this historic time for what we can do together, the only thing that exceeds my admiration for you is my hope for you. The moment is now, and the moment is yours. Thank you, congratulations, and let's do this.